Welcome to DLib's Evidence-Based Medicine series. I'm your host, Saad Laws. In this video, we'll be hearing from a few clinicians and expert students about how they approach evidence-based medicine, and you'll learn some tips and insights from their approach to evidence-based medicine. So now, let's sit back, enjoy the video, and let's learn together.
Right, well, evidence-based medicine really is one of the major backbones of modern-day medicine. It separates modern medicine from quackery or old hat medicine, and it means that we can practice what we think is the best available medicine for our patients when we take it in context, and we put it into context with clinical expertise, clinical experience, and of course the needs of the patient or the desires of the patient.
Yeah, I think evidence-based medicine is really about using the best available information to do the best for your patients. We want to make sure that what we prescribe or what we tell them about what's going to happen, or even how we explain how diseases work, that it's really based on good research, good data, and that it really gives them the best chance of achieving their goal.
I think the fact that we know the level of confidence and the sort of scientific rigor on which we base our clinical judgments helps us feel, both better informed and more convinced about our clinical actions. So I would say that it just makes us feel that we're, hopefully giving better care to our patients if we are able to engage with best medical evidence in practice.
There's no questions that's in my mind that since I started learning the skill of evidence-based medicine and polished it further, that it has impacted positively the care that I provide for my patients. I mean, I'll give you a practical examples. Many times I get faced with questions the patient posed to me, or even questions that I have about a diagnosis for a patient or management for a patient that I really don't know what's the right decision actually to take for that individual person. And I feel that if I have not had developed that skill over the years, I would not have been able to give my patients the best care that they deserve.
The first thing is basically understanding what my query is, for me to understand it and clarify it so that the person who's reading the paper understands it as well. And I find it difficult because sometimes you know that there's a question you have in your mind, but you can't really define it. And for an EBM paper to become more, let's say, more reliable, or not even more reliable, just more comprehensive, it's better for you to define the population, for example, or the intervention or the outcome. So that's hard. That's always hard for me.
I would consider the most challenging part defining the research question because it is very important, so I spend a considerable amount of time on it.
So I think it's very, very helpful to be competent in your searching skills. I think it saves a lot of time and it helps find the best available information. So I think the more skilled one is, the more one practices and maintains those skills, the better off one is in being able to practice best evidence medicine.
So I think the value of searching is really to make sure you have a clear question and then to use that search to really give you the best answer, and that informs then your clinical decision making.
EBM search in general is not easy to do. It's something that takes a lot of skill, and it's an ongoing process. You only get better at it the more you do of it. The thing is about EBM search is that whatever evidence you may find, it's not law. It's a guideline at best, and you have to be objective in the way that you use it, and you have to be able to critique it at the same time. And you need to be able to find the proper resources. Some resources are better known to provide better EBM results than others, and the way you know how to find these resources resources is, you know, you ask people who know more about them. You can ask the physicians that you work with, you can ask your librarians, you can ask your other colleagues that use those specific resources. It doesn't really matter which resource you used, as I mentioned, as long as it's a resource that provides, you know, papers and evidence that is trustworthy.
All right, you probably already use a lot of evidence-based research methods to go through your searches, but now is the time where you're going to have a structure and you need to get this right get the basics right from the first time.
I think start with the basics. Evidence-based medicine can be complicated, but you need some basic principles, get them under your belt, and then use them as soon as you can and as often as you can.
There are certain moments, I know for sure, there are certain moments where you're going to ask yourself, is that the best management, or is that management affecting the patient in a better way, or even is that diagnostic test is better than another one, for example. And once you have that question, seize it. Don't leave it and don't just say, oh, that's it, khalas. No, go ahead, look it up. Understand that there might be definitely more available options out there. Maybe the certain setting that you're in is not providing you with it, but there might be available options there.
So at first it's really overwhelming because you have a lot of resources, a lot of websites, and you don't know which one to use. I think the best thing is to be comfortable with just one or two at first that you would constantly use to get your information, and then expand upon it as you get, you know, better at it. And of course, again, you know, ask and seek help from other people at the same time. The other thing is, you know, not to be too specific in your searches. You don't want to be plugging in every single word that you're looking for, because you might not find what you're looking for, and at the same time you might pass the opportunity to find important information on the way that might be relevant for your search.
Well, I hope you learned as much as I did after hearing what our clinicians and advanced students had to say about evidence-based medicine. Hopefully you can take what you've learned here today and apply it over the course of the next few weeks as we begin our study of evidence-based medicine. And then later on, when you have patients of your own, you can apply evidence-based medicine there. Well, that's it for now. Don't forget to move on to Module 2, Background Questions. Thank you and good night.